I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over why do I wake up with a sore back. So many of us wake up with a stiff back, a sore back, a painful back, whatever you want to call it. We hear a lot of different words to describe kind of the same thing in here. So why is that happening? Why, when you go to bed and you're supposed to wake up and you're all nice and rested, do you wind up waking up with a stiff or a sore back or a painful back, and you have to kind of give yourself a minute? Sometimes people can just get right out of bed and then they take a hot shower and it goes away. But some people, they have to take a minute, they stretch, but this back issue, this back pain, this back discomfort exists every morning or most mornings. And a lot of times what will happen is you'll find that it doesn't stay just with one morning. It'll do 2 mornings, and then all of a sudden it'll be 5 mornings, and 10 mornings or whatever. And that's a sign of a problem that's getting much worse. So you really want to be careful if you are waking up with back pain. And some of you say, I've had it for years, and I get that, and that means there's more of a problem there than most people. So it's not normal to wake up with back pain. Now, if you're traveling, if you've fallen asleep in a weird position, if you're sleeping on the couch, or sleeping in a different bed, that is completely normal to wake up with a stiffer back because your mattress has changed and your circumstances have changed. So that's not really an indication of a problem. That's an indication that something happened or you changed your environment and your back responded accordingly. So that's nothing to be alarmed about. But if you're sleeping in the same bed and you continuously wake up with back pain, or if you notice that it takes a lot longer for the back pain to go away, those are really big warning signs that something's going on. And this is usually the first place that chronic back pain starts. Most people think that chronic back pain starts with a car accident or something along those lines, something severe trauma, some accident, some work accident. And most often a lot of back pain, a lot of chronic back pain that never goes away, just starts with that morning soreness, that morning stiffness, that stiffness at work. What people wouldn't even describe as pain, that's what usually will kick off some of these lifelong back problems that people suffer from. So it's really important to take notice of back pain. And is it just one morning that you're waking up with it stiff? Or do you notice several mornings you wake up with it stiff? Or does it take longer to go away in the morning? Could you stand right up and now you can't? Really pay attention to these things. Another thing is people often will write this off to just arthritis and I'm getting old. That's not the case. If you've gotten a good night's sleep and you're in proper position and you wake up and your back's stiff or your back's sore, you can't really write that off as arthritis. There's something going on in the middle of the night that you really want to be aware of, and you really want to check on your posture, and you want to check on exactly what's going on, because it is an indication of something worse to come. So, and it may not happen overnight, it may take years, it may take months, it may take days. So really, this is a very big warning sign that most people ignore when it comes to back pain, but it's something that you shouldn't ignore. It really needs to be paid attention to because it's important that you address it when it happens. So why does your back get stiff? Well, there's a number of reasons, and the first reason is usually it has to do with the muscles, and the muscles not being aligned correctly, and the muscles actually not moving. So when you're asleep, if you're a stomach sleeper, there's totally different reasons why your back hurts. But a lot of times when you're asleep, whether it be on your side or even on your stomach or on your back, you don't move. Now, a lot of people say, oh, I wake up in a completely different position when then I go to bed. You will move a little bit during the night, but most of us don't move a lot during the night. So it's really easy to wake up with a stiff back because those muscles have sat dormant. They've laid there. They haven't gone anywhere. They're not in good position. So it's really important that if you go to bed for the night and you want to make sure that you're set up in a proper posture, otherwise you are going to wind up with a stiff back. And yes, when we were 20, we could sleep anywhere and do anything, but now that we're a little bit older, we can't do that. So waking up with a stiff back is generally muscle soreness, and it's usually because you slept in an improper posture, and possibly, and also because you've done something that day that aggravated it. So you'll say, well, all I do is sit at work, and that means that your blood, your muscles got very little blood that day. It takes you moving to actually supply those muscles with a lot of blood. So, and that blood will loosen them up and keep them out of the stiff postures that cause that pain in the morning. So if you're laying there or you're not, in proper posture, or you're not, or you're waking up with a stiffness, it's really important to understand that this is a muscle issue and it generally will get worse. Now, I'm not talking about numbness and tingling going down your leg, and I'm not talking about severe pain. That if you wake up with severe pain or numbness and tingling going down your leg, you need to be in treatment. That's not something to mess around with. That's a significant warning sign that something is coming. So you need to, it's not coming, it's already here. So you really need to seek out treatment. But the other reason that you wake up and you're sore is most often because of the daily activities that you have done and how you lifted wrong or you sat wrong. We really abuse our backs, and we're really not nice to our back all day long. So if you sit and if you're slouched in a position like this, you're putting some of the highest amount of pressure you can put on your discs. So not only are you not really moving and you're sitting here like this, and most of you will be like, oh, well, I turn, I have 2 monitors, whatever. This type of movement doesn't really count. When I'm talking about movement, I'm talking about standing up, maybe shifting your weight. It doesn't have to be a walk to the water cooler, but you really want to make sure that you are getting some movement. Sitting for an hour is not okay. Now, a lot of us, when we stand, sometimes we'll stand slumped over. Most of us will be standing on our smartphone, so we're like this anyway. Again, we're putting a lot of pressure on our back. Or if we bend over and try and get something off the floor, we actually are really herniating our discs. So we've done all of this abuse all day long. It doesn't show up, and that's the hard part about the muscles in your back and the muscles anywhere in your body, is most of the time that when you are hurting your muscles, you have no idea you're doing it because your body will just kick in and fix it. If you go and you feel a pain, you probably have torn something or done something really, really bad to that muscle. So that's the tough thing about having back pain that shows up in the morning is, what did you do yesterday? What caused this? And you have to kind of go back and weed through some things, and most of the time it's a combination of things, and it's really not a great combination of things. So what you want to do is, if you're waking up with a stiff back, you need to kind of go backwards and see exactly what you've done the day before. Did you sit too long? Is your computer set up correctly at work? Are you sitting in front of a laptop like this? If you have a laptop and you're in front of that laptop more than an hour consecutively, you need to make sure it's set up correctly, which means you need a separate keyboard or a separate monitor. There's no way you can have proper posture without sitting correctly. Did you bend over and pick up a million things? Were you lifting things, and were you not watching your posture? Yes, it's a pain to squat down or to bend down or to kneel down, but if you continue on the path of waking up with back pain, that will slowly progress where you won't have a choice. You will be out of commission, or you'll have a back spasm that will take you out for a couple of days, and you won't be able to lift, or I guess if you're lucky, it's only a couple of days. But you want to make sure that you retrace your steps. Also, you want to pay attention to your sleeping position. Are you laying flat on your back? If you're laying flat on your back, your knees should be elevated, and your knees should be elevated to a very high degree, okay? A lot of times we'll just put a pillow underneath our knee, and the pillow will just be so soft it'll sink. All right, you're probably going to need like 3 or 4 pillows to bring your knee up to the point where it needs to be in order for it to allow your back to have some really good blood flowing to it throughout the night. You also want to make sure, if you're on your side, you're waking up stiff, that you have something between your knees. Maybe that's not enough. Maybe you need a little pillow here or a little bit of towel there, especially if you have bigger hips or a gap right there. A lot of people will report that type of towel or something is really uncomfortable. So most of the time, just having something in between your knees is more than sufficient. Sleeping on your stomach, I have no solution. You really want to get off your stomach if you're sleeping on your stomach. So when you go through your day, if you're waking up with low back pain and you're waking up with soreness, that's a really big indicator that something is going wrong, and you've done something the day prior that really has been building up, and you want to find out what it is. Did you drive too long? Did you sit too long? There's a couple of things that can really trigger it and cause that back pain. So the big thing to do is you have to play detective, and when you want to figure out exactly the reason why that you have that back pain, it's because of sore muscles, it's because of stiff muscles. But why do you have those? And that's something you have to answer and figure out. Are you sitting too long? Are you standing too long? What's going on? Are you bending over to lift? That's a very, very, very preliminary sign of things that are going to go bad in the long run.